Hi, this is Mike Protack with another one of our series on issues affecting the state of Delaware and our country. And like we talked a couple days ago about healthcare, we're going to follow up on healthcare to talk about what's called the public option, which right now is a bit of a moving target. We haven't heard what the Washington politicians really want to do with this public option, so it's a bit unclear, but we'll talk what we know about the specifics as it exists today. Essentially, the public option is a political answer to a financial or economic problem. It's a way of having the Washington insiders attempt to address health care with a one-size-fits-all solution, which may or may not get to universal care, which is the ultimate goal, with some quality health care. So what we have to do is kind of go back to what Medicare and Medicaid, which have been public attempts to fund health care for certain groups. Of course, Medicaid is a federal state program for low-income people, and Medicare, of course, is for senior citizens. Both, by the way, are paid with a single rate flat tax and come from tax revenues. So let's talk about Medicare and Medicaid. Most people don't know it, but Medicare and Medicaid, quote, stay in business, not because they're better programs than private insurance. Little known dirty fact is they pay doctors and providers less than private insurance. So in other words, a hospital, if it was 100% Medicaid patients, would lose money every year, because Medicaid traditionally pays about 75 to 76% of what healthcare costs for that institution. So past history tells us that Medicare and Medicaid generally don't pay as well, and that's how they stay in business, by squeezing providers, and that's been going on for many years. And in fact, the President said yesterday he would pay for part of the public option by reducing or squeezing healthcare providers for senior citizen care, which is Medicare. Again, that's a bit of cost shifting. That's part of the problem with private insurance at times, is cost shifting, and of course the Washington elites seem to think that's okay to do for a new entitlement. But let's also talk about what Medicare and Medicaid have done for the long-term prospects of this country. Most people don't know it, but Social Security is a big program for seniors, and something I'm concerned about as a middle-aged person. We have about pardon me, $15 trillion of unfunded liabilities for Social Security. Most people don't know this. Medicare has 5 times that amount, folks. 5 times. That's $74 trillion in unfunded liabilities. Effectively, the United States of America is bankrupt based on those principles. So when we look at a public option that's going to move a substantial amount of private health care into the public arena, not knowing what the program is going to look like, sometimes is guesswork, but we can look at past history for future performance. And what we look at Medicare and Medicaid, that's not a bright picture. Not that addressing universal health care is not an ambitious goal that should be attempted, but certainly when you take a public proposal, that may not be the smartest thing to do. Now, something else that a lot of people talk about private insurance, it's cumbersome, it's irritating, and I agree with that. But Medicare, folks, has 1,700 pages of rules. Now, let's put this in comparison. War and Peace has 1,463 pages. It's a big novel, big book. Medicare has more rules and by pages than War and Peace. And that's not a direction we need to go by. Now, the public option, again, because it's a bit of a moving target, how do we pay for this? Let's address who's going to be covered. Essentially, almost anybody. And part of the proposal is being floated right now in Washington by those politicians who can't seem to solve any other problem. They want to add more to our federal deficits, is by subsidies. Now, some subsidies will be appropriate for low-income people. There's one proposal out there that for a family of 4, you would get up to 5 times that amount. In other words, let me reword that a little bit. You can make up to $110,000 for a family of 4. That's 5 times the poverty rate for a family of 4. That's how much the subsidy you could get. That's how high it's going to go. A family making $110,000 for a family of 4 would get subsidies to pay for this public option. That's not an inducement to save money. That's an incentive to spend more money, your money, taxpayer money. So let's talk about what this really comes down to. It's unfortunate, but the outreach has started, but it's sort of stopped already, because the American Medical Association, a group that I think knows a lot about health care, has said they're against this public option for many reasons. But let me do best here to go through one by one the things we talked about a couple days ago and see if this public option does the things we think is important. Now, if you remember these little slides, does the public option talk about patient-centered health care? Well, no, it doesn't. Is it hassle-free? It remains to be seen. We just don't know. Does it fit your lifestyle? Certainly not. It's very much a one-size-fits-all cookie-cutter approach. Let's talk about the other things that are very important. Does it promote wellness? Well, if you go by Medicaid and Medicare's history, no, it doesn't. Will it increase productivity? Probably not. Does it give you security? Maybe. Again, that depends on how we pay for it and how much it's going to cost. The estimates are between $650 billion to $1.3 trillion. It's a lot of money. We'll have to see. Does it increase choice, competition, or give you the need to have responsible health care for your own choices? No, it doesn't. It does none of those things. And that's unfortunate, but it just doesn't. In the end, is the public option a balanced, common sense approach to health care? I think not, and most people don't, including the American Medical Association, for one very simple reason. It again is a political solution to an economic problem, which means spending more money in an area that needs to have some reform or transformation, but certainly not more money spent incorrectly. And once again, I'll go with what the doctors think. They think it's an unwise move, and most people who have to pay for this thing think it's an unwise move. So again, covering everybody, universal care done smartly on the principles we talked about a couple days ago is a good thing. The public option, by all accounts right now, is not. There are better ways to do that, and tomorrow we're going to have an option for the state level called Delicare, which addresses all the issues we spoke about a couple days ago. But right now the public option falls way, way short. And I want you to remember this. $74 trillion in unfunded liabilities right now for the Medicare program. That doesn't mean we don't have to take care of senior citizen health care, but $74 trillion is a lot of money. We don't have a means to pay for this unless we want to raise taxes, raise fees, or in the end, the one thing we don't want to do is reduce the quality and quantity of health care. And right now that's the only way to do that unless you're going to spend a lot more money that we simply don't have. Anyway, thanks for viewing. We're going to be talking more about health care. Coming up, we're going to be talking about government reform, inspector general, initiative, referendum, and reforms, those sort of things, along with the state budget. So stay tuned. Thanks a lot.